Hernia is when tissues or organs bulge through a weak point in the surrounding muscle or tissue wall. Types of hernia. Common types of hernias are follows. 1. Inguinal hernia. The most common type, where part of the intestine or fat bulges through a weak spot in the groin. 2. Incisional hernia. Occurs at the site of a previous surgical incision, often because the scar tissue weakens over time. 3. Umbilical hernia. A bulge near the belly button, which can be present at birth or develop in adults due to strain. 4. Hiatal hernia. The top of the stomach pushes up through the diaphragm into the chest cavity, often causing heartburn and reflux. 5. Femoral hernia. Occurs lower in the groin, in the upper thigh, and is more common in women. 6. Epigastric hernia. A bulge that appears in the upper abdomen between the belly button and the breastbone. 7. Spigelian hernia. A rare type that pushes through the abdominal wall layers on the side of the abdomen. 8. Peristomal hernia. Develops next to a stoma, a surgically created opening on the abdomen for waste. 9. Ventral hernia. A general term for a hernia on the front of the abdomen. Incisional hernias are a type of ventral hernia. 10. Congenital diaphragmatic hernia. A rare birth defect where the diaphragm doesn't close completely, allowing abdominal organs into the chest cavity. Causes of hernia. Inguinal and ventral hernias may develop due to several factors, including obesity, aging, chronic cough such as with COPD, and strenuous physical activity requiring heavy lifting, such as construction work. Certain rare conditions such as collagen vascular disease or genetic defects involving connective tissue may also cause abdominal hernias. Complications of hernia. 1. Hernia incarceration. Intestine or other organs can get stuck inside of the hernia defect. This process is called hernia incarceration. When hernias become incarcerated, they can cause severe pain. And if the intestine becomes stuck, other symptoms such as nausea, vomiting, and diarrhea can develop. Some hernias are chronically incarcerated when they are present for so long. However, if there is any concern, immediate evaluation is necessary. 2. Hernia strangulation, when the stuck contents become damaged and extreme pain or other symptoms develop. This process is referred to as hernia strangulation. This is a surgical emergency which needs evaluation and surgical fixation right away to save whichever organs are stuck inside the hernia defect. Diagnoses of hernia. Your doctor will ask about your symptoms and examine you. Your doctor may ask you to cough, strain, or stand while pressing on the hernia. Hernias can be diagnosed without tests, but your doctor may sometimes recommend tests such as an ultrasound scan, a CT scan, and MRI scan treatment for hernia. Most hernias will need surgical repair, but not necessarily right away. If you have a small or mild hernia that only comes out occasionally, your healthcare provider may take a wait-and-watch approach to see if it gets much worse. Hernias do tend to worsen over time, which is why providers recommend repairing them. With the exception of umbilical hernias in babies, they don't go away on their own. Laparoscope surgery uses a laparoscope, a long, thin tube with a lighted camera on the end, to look inside the surgical site. The laparoscope goes in one small hole and long, thin surgical tools go through another. Robotic surgery for hernia repair is similar, but the surgeon controls the tools from a computer console, using robotic arms. Some hernias may need traditional open surgery. A congenital umbilical hernia will often close on its own as your child grows, but sometimes it won't. In this case, your child will need umbilical hernia repair. A hiatal hernia often won't need repair, but it may if it causes chronic acid reflux. Your provider may recommend a Nissen fundoplication to repair this problem. It involves wrapping the upper stomach around the lower esophagus and stitching them together. What happens if a hernia is left untreated? A small hernia may never bother you much, but hernias do tend to grow bigger over time. The opening continues to weaken and stretch, and more tissue gradually pushes its way through. The more tissue pushes through, the more likely it is to become incarcerated, leading to pain and other complications. Thank you.